Welcome. My name is Peter Strong. I'm a professional mindfulness-based therapist based in Colorado, USA, and I offer online therapy for anxiety disorders, depression, addictions, and particularly for the treatment of OCD. I get a lot of requests for help with obsessive-compulsive disorder, and particularly with intrusive thoughts. Many people suffer quite severely from intrusive, repetitive thoughts that just basically obsess in the mind and cause a lot of suffering and lead to a lot of unwanted behaviors to try and avoid and get away from these intrusive thoughts. So if you're looking for an online therapist for OCD and you'd like help in working with intrusive thoughts, then please go to my website and learn more about the online therapy service that I offer for treating OCD and anxiety disorders in general. And please send me an email if you have any questions. Most people really enjoy the mindfulness approach because it's very practical. It teaches you how to neutralize those intrusive, obsessive thoughts. Trying to approach the problem of obsessive and intrusive thoughts by some sort of rational thinking approach is just not going to work. In fact, you already know that these intrusive thoughts are not rational, are not likely to occur, but it doesn't stop them, okay? And this is because the intrusive thoughts have a very strong emotional charge, and it's that emotional charge that causes them to stay in the mind and to repeat over and over again. It's the emotional charge that we have to work with, and that's the primary focus in mindfulness therapy. It doesn't matter whether the thought is rational or irrational. That's not the point. The point is that you have to neutralize that emotional charge to allow that thought to subside and go away. If you really want to stop intrusive thoughts, you must neutralize the emotional charge of those thoughts. So the way we do this in mindfulness therapy is by actually meditating on those intrusive thoughts. We don't try to run away from them, we don't try to avoid them, we actually meditate on them, which means we hold them as a primary object in our meditation. We look at the thought and we start to change our relationship to it. That's the first and most important thing. So typically what happens with highly charged emotional intrusive thoughts is that whenever they arise in the mind, we become completely consumed by them. We become overwhelmed by the thought. We become identified with it. So the first step in mindfulness training is learning to literally sit with that thought without becoming reactive, without reacting with fear, which is the primary energy in intrusive thoughts, or aversion, some form of hatred or resistance. We have to learn to sit with it and not react. That's the first training. And the only way to do that is to consciously and actively focus on that thought, on training in that way, to sit with the thought. You can't do it by some other indirect method. You must work directly with those intrusive thoughts. The second part of our mindfulness work becomes possible once you stop reacting or identifying with those obsessive thoughts. Then we work on neutralizing the emotional charge. And that really is mostly about working with the imagery of the thought, because emotions work through imagery, and very highly emotional thoughts or images, for that matter, or memories or other intrusive type imagery. The thing that makes it emotionally powerful is the properties of that imagery itself. How you see it in the mind is what creates the emotion itself. So we look at this imagery and then we start to change it, because when you have a non-reactive, conscious, mindful relationship with the intrusive or obsessive thoughts, then you can begin to explore changing its properties. For example, making it a lot smaller. So an obsessive or compulsive thought, by its nature, will be very large. That is the imagery. The imagery is probably also going to be very close. That's how you see it in the mind, very, very close. And that is what creates the intense emotional charge of the thought. Its position, its size, its color, where you see it. Do you see it above you or at head level? All of these details of the imagery are what actually cause the emotion. So changing all of these details are how we can neutralize obsessive and intrusive thoughts. The same applies for traumatic memories as well. When I work with PTSD, the primary problem that people suffering from PTSD encounter are these very intense, intrusive images, memory images. And the same thing applies. We try to establish a non-reactive relationship with that image, and then we explore changing the properties of the image. Again, even make just the simple action of making it 100 times smaller in size can greatly reduce the emotional charge of that memory image. So the same principle works for PTSD as it does when working with OCD. We need to neutralize that charge, and the most effective way of doing that is to work with its imagery. So if you'd like to learn more about working with an online therapist for OCD, you would like to learn the mindfulness approach for overcoming OCD and working with intrusive thoughts and memories, then please contact me and let's schedule a Skype therapy session. So I see my clients through Skype because it's convenient for my clients, and it's also much more comfortable for most people. It is less clinical in nature. I do not believe in a clinical approach to emotional suffering. I believe in a much more personal and educational approach, teaching you the skills on how to work with your emotions. I certainly do not advocate medications, because medications will do nothing to change the underlying habitual process and that imagery, for example, that causes our emotions. So if you'd like to learn practical ways of working with your OCD and intrusive thoughts, then please reach out to me and let's schedule a Skype therapy session. Thank you.